Hi, I'm Kayla LoCoco, and I am a first-year DBT student at Midwestern University. Today I will be discussing and going over a brochure that I have created on the joint disorder Ankylosing Spondylitis. So here is the front of the brochure. I'll discuss and talk over the brochure, and then I'll show you the brochure at the end of the video. So, do you have back pain, inflammation, and have you heard of a bamboo spine? These are all related to ankylosing spondylitis. So what is ankylosing spondylitis? It is a seronegative spondyloarthroplasty joint disorder. This disorder is an inflammation disease that can cause bones in the spine to fuse together. This fusion makes the spine less flexible and can lead to a hunched posture. This disorder affects the spine and proximal joints. The risk factor of this disorder is that it is more common in men than in women. The average age of onset is between 20 and 40 years old. The etiology is both genetic and environmental. The genetic allele is HLA-B27. So this gene, if you have this gene and it interacts with the environment, it can help trigger the disease. So what is the signs and symptoms? Number one is back pain. Sacroiliac joint pain. This joint involves your sacrum, pelvis, and lower spine. These joints are between the top part of your pelvis and the bony structure above your tailbone. Usually have a right and a left side that will start hurting in your lower back. The proximal joints are also involved, and these are shoulders, hips, lower back, neck, and ribs. Enthesesis is also a sign and symptom. This is inflammation of where a tendon and bone meet or a ligament and bone meet. This inflammation is bad in this area due to the blood supply being poor. If this disorder is untreated, then you might have a bad case of kyphosis in the spine, which is just that hunched posture. There's also bone erosion, impaired range of motion in the spine and proximal joints. You may also have difficult breathing due to the rib mobility. Also, there's spinal nerve compression, heart arrhythmias, and visual changes. This is due to the inflammation affecting the eyes as well. So, how do you know if you have ankylosing spondylitis? You will get your diagnosis through lab work and imaging. You will have a rheumatoid panel, and this result will show elevated ESR or SED rate and elevated CRP, and also gene HLA-B27. The rheumatoid factor will usually come back negative. This is why it is a seronegative spondyloarthroplasty joint disorder. Also, you will have imaging, which is usually just a plain radiograph, which is just an X-ray. Also, an MRI. So I'll show you this picture of what the X-ray will look like. This will give you your bamboo spine, and usually the spine won't look like this until you are at more of an advanced stage of this disorder. So the medicine management, the main medicine is methotrexate. Also, they use TNF inhibitors and also interleukin 17 types of medication. So how can a PT help with ankylosing spondylitis? So physical therapy is one way to stay active when having a joint disorder. PTs can also educate you on the joint disorder, also create exercises which will help strengthening, flexible, and stretching. Also, PTs can help with managing swelling of inflammation. PT can help reduce stiffness in joints, improve posture and flexibilities. Physical therapy can help reduce pain as well, and if needed, modification for environment factors and or if education for walking assistant devices, but this is more related to the advanced stages of this disorder. So here's the brochure, the front page, then your next page, the signs and symptoms. How do you know if you have this disorder? And here's the x-ray. Then you have your medicine and how PT can help. And then also here's the back page that shows the references I used. Okay, thank you.